What is arthritis in the spine and what can you do about it? You may have been told if you've had x-rays of the spine or an MRI at some point that you have wear and tear or arthritis in the spine. And that can sound quite concerning at first because we don't like the sound of arthritis. It makes us feel old and you wonder whether or not it's going to spread to other joints and things like that. Well, it's not. First of all, I'm going to talk about what arthritis is, and in this sense we're talking about osteoarthritis. And secondly, we're going to talk about what to do about it. So osteoarthritis is the most common form of arthritis and is otherwise referred to as wear and tear. But for reasons I'll explain in a minute, I don't necessarily agree with that because it doesn't occur in areas that have more wear. In fact, it occurs in areas that don't receive enough movement. And it also implies, the wear and tear thing implies that it's just something that's inevitably going to happen with age. But again, as we'll see in a minute when we look at an x-ray, that's not always the case. So, yeah, osteoarthritis. I want to differentiate, first of all, between that and other forms of arthritis, like rheumatoid arthritis, for example, which is a disease, an inflammatory disease in the body that tends to affect joints like the hands. It's when you see people with their fingers kind of twisted up and that kind of thing. That's usually rheumatoid arthritis. But for today, we're talking about osteoarthritis. Wear and tear in the spine occurs when the discs in the spine, the shock absorbers between the bones, wear out, get thinner, and the bones themselves start to change shape. So they'll get these spiky bone spurs there. They'll get a bit gnarly. Instead of being nice and kind of fresh looking and crisp edges on the bone, you'll get this spikiness. That occurs in these joints between the discs, where the discs are, so you can get compression of the discs. That's a good one. And that's the opposite end of the scale. You'll see that there's no disc left, which means no shock absorber. So that's not going to move very freely, but also it's going to have no shock absorption. And it can cause a lot of stiffness and aches, as you can imagine. But it also affects the joints at the back of the spine, and that really affects how well everything moves. Right, so it's worn out discs and gnarly bone spurs, and accompanied inflammation and stiffness and pain. Right, how does it happen? As I alluded to, the joints in the body, including the ones in the spine, they like to move. It's their job in the world is to move. Now, if they stop moving freely, that's when the problems occur. Now, they might stop moving freely because of an injury that just kind of knocks it slightly out of its position, so now it can't move freely through a full range of motion anymore. But it could just be through repetitive work, like carrying stuff on the same shoulder, a lot of stress and strain on the body, or just like very sedentary lifestyle and work. So what happens when the moving parts in the body stop moving properly is that they're no longer able to pump fluid into and around the joint. And now the fluid is important because it lubricates the joint, but it also supplies nutrition. So the fluid brings nutrients to the discs and to the joints and to the bones and to the cartilage that helps to repair it and regenerate it. So it takes away old debris, old damaged tissue, and it regenerates it with new materials that's been brought to the area. But you can't get that if you're not getting a good enough fluid flow. So that's why any moving part in the body, especially the ones in the spine, there are lots of them in the spine, needs to move freely. And that's what we check. So when you come in, we do an examination and we're pressing around on your back and twisting you this way and that. We're checking for each individual joint to see how well it's moving. Because you might think, yeah, I think I'm fairly nimble and I can kind of move around okay, but you're not aware of how each individual one's moving. And we need to zone in on each of them to make sure that they're all healthy. Right, so it can occur through injury, immobilization. Some people are more genetically prone to, just like everything, more genetically prone to arthritis. So regardless of what injuries they've had or what their posture's like, etc., they're just more likely to get it, unfortunately. But I want to dispel the myth that it's an inevitable part of aging. Now, this is an image that I just got this on Google. So this shows a neck. Do you know what? I'm going to switch you here. This shows an x-ray of a neck. That's the jaw. That would be the back of the head there. And what we're looking at is the vertebrae. We're looking for the vertebrae, which are the bones, and then the disc spaces. You can't see the disc because it's not dense enough, but you can see the space where it is. And you're looking, ideally, for them all to look a bit like that one and this one. So the nice crisp edge on the bone, good even space on in between. That means that the discs are pretty healthy. So what we're looking at there is, so that space there is that space there. But as we go down, you can see it starts to change. So now you can see that the disc spaces are getting thinner. That means the disc's worn out. And you can see that it's no longer nice and even on the front. You've got this bone spur there, this sort of claw-looking thing. And what that's trying to do is fuse eventually with the one above or below it. So this is what we call arthritis, otherwise known as spondylosis when we're talking about the spine. So this is what we call arthritis in the spine. But I'd like to point out that that bit is not any older than that bit. They're exactly the same age. They're exactly the same age. So why would one part look like, you know, a 25-year-old and one part look like someone, you know, twice that age or 3 times that age? I don't like to put ages on it, but you know what I mean. And it's because those vertebrae in the lower neck stopped moving properly. Maybe there was an injury or all the reasons we just discussed. Something happened to that a long time ago, probably 20 years ago, based on how much the bone spurs have grown. And that stopped it from repairing and it caused wear and tear. So what can you do about it? Right, in order to stop it getting like that, keep things moving properly. So, and that's why chiropractic adjustments help, but also general mobilisation exercises and being active, having good nutrition and all that kind of stuff. But what can you do when it gets to that stage? To be honest, a bit of it's damage limitation. You're not going to undo that. You're not going to undo 20 years of wear and tear. But even though you've got worn out disc and you've got these joints that are stiff and a bit arthritic, you can still get them moving better than they were. So you can still restore its range of motion to much more than it was, you know, before, over a period of time. And by doing that, it makes it feel better and it helps it heal and regenerate better than it has been. Yeah, there you go. Now I want to show you another one quickly. And that is this picture here. I'm going to bring this up as well. So this is the one we just looked at. This one, now look at these beautiful disc spaces. There's basically a little bit of arthritis in these joints here, but the discs are maintained. Now this lady is 75 years old. She's 75 years old. There's minimal wear. The bone density is a little bit lower, which happens a lot in older ladies. So she wants to be on vitamin D and having enough protein and that kind of thing. But I wanted to show you that compared to that, because there's a big difference there. And this is by no means the worst that we see, by the way. And yeah, this just goes to show. It goes to show that it's not age. It's not just age. Age is a factor, but that's not the only factor. Yeah, so I hope that answers a few questions. I just wanted to talk through with you what arthritis in the spine is, how it occurs, and what to do about it. So if you've been told that you've got arthritis or wear and tear in the spine, don't be alarmed, don't be concerned. Just find someone who can help you with it. We can restore range of motion, we can help it to feel a lot better, and the intention is to try to slow down the rate of wear and tear by keeping it moving properly, keeping your posture aligned, and showing you what to do to help yourself. Got any questions about that? Let us know. Take care.